Good morning. I'm Julian Samuels, and we're here in my office in Norton Commons. And today on Monday Makeover, we're going to talk about the neck and the décolletage. I get asked about these areas a lot, my nurses and my estheticians and I. And we have many options for this. We'll break it down into first the injectable options. So if a patient has unwanted fat in the neck region, we can inject a substance called Kybella. This is an enzyme that destroys fat. You have about 2 weeks of downtime, and then you typically have to repeat that procedure. But there's no surgery, no incisions, no anesthesia, just a little bit of swelling in the neck. Next, we will use Sculptra, which we've talked about on this program before. It is injectable, but it's a collagen stimulator, so it can help with those wrinkles of the chest that we get due to sun exposure and athletic activities. Next, we have laser options. We like Forever Young BBL for brown spots, tone, and texture. We like a very light core treatment of the neck. That can be done to smooth that crepey skin. And last but not least, we have our energy devices such as Profound microneedling with radio frequency. So that has a little bit of downtime, maybe a week of some redness. We have Exceed microneedling, which is no downtime because there's no heat. So you get that instantaneous tone and textural improvement. And last but not least, we have some of our other laser options for brown spots. And then of course, a very important part of any neck and décolletage result is the skincare that we use between these treatments. And so we want to focus on good products that moisturize the neck, reverse damage, not just prevent additional damage, and restore that important elastin and collagen network that keeps the neck taut and more resistant to the gravitational effects of aging. So one of our favorite one and done technologies, of course, for the neck is liposuction. So once I've done the liposuction, I have these channels through the fat that I can send that Renuvion heat. And the Renuvion heat hits these fibers, tightens them in response to the heat, and then tightens the overlying skin. And as you can see in this gentleman, we get very, very nice results. The middle picture is 5 weeks, and the picture on the far right is 4 months. If a patient does not wish to have surgery, doesn't want any incisions, doesn't want anesthesia or any downtime, we can inject an enzyme called Kybella that will melt fat instantaneously. Recovery is 2 weeks of some mild swelling in the neck, and then typically the procedure is repeated. Moving on to a little below the neck, we can use Sculptra for the décolletage. And injected deep, Sculptra is a collagen stimulator, and this will nicely smooth out surface textural issues, wrinkles that commonly occur in, especially women, between the breast area and overlying the breastbone. Another really good treatment for the neck and the décolletage are some of our energy device treatments incorporating radio frequency. This is an example of what we can do for the neck and also continue it down onto the chest for a patient to generate new collagen and elastin. And finally, Excellis radio frequency treatments, gentle heat on the lower face, neck, and décolletage for textural improvement of the skin in those areas. As plastic surgeons, we really believe in good quality prescription skincare that is customized to every patient. So I wouldn't treat a 25 or a 35-year-old with the same neck products that I would treat a 55 or a 65-year-old woman with. We want to look at ingredients. We want to be targeting things that will reverse damage, enhance elastin, and enhance collagen. And if we can make the skin thicker, it can resist the gravitational effects of aging far better in that problematic neck area. So thanks again for joining us for this Monday's segment of Great Day Live. For joining us and just mentioning Great Day Live, we're happy to extend a complimentary consultation to our viewers and also 10% off a skincare package that we can customize for your neck and décolletage. Thanks again, and we hope to see you next week.